Good afternoon. I am Dr. Anupama Singh, Assistant Professor in Department of Community Medicine, Santosh Medical College, and topic for lecture today is antenatal care. So, antenatal care is defined as the care that is provided by a skilled healthcare professional to the pregnant lady in order to ensure the best health conditions for both the mother and the baby during the pregnancy. The antenatal care is basically the care that is given to the woman during pregnancy with the objective to promote, protect and maintain the health of the mother during the pregnancy, to detect if there are any high risk cases and give them special attention, to foresee the complications and prevent them, to remove any anxiety or dread associated with the pregnancy, to reduce the maternal and infant mortality and morbidity, to teach the mother elements of child care, nutrition, personal hygiene and environmental sanitation, to sensitize the mother to the need for family planning, including the advice to cases seeking medical termination of pregnancy, and how to attend to the under 5 accompanying the mother. So the antenatal care has the following components. First is the antenatal visits, the prenatal advice, the specific health protection, mental preparation, family planning and pediatric component. And now we will be discussing this one by one. So let us first talk about the antenatal visits. So, a minimum of 4 antenatal visits covering the entire period of pregnancy is the target, but ideally, antenatal care must be attended by the mother, antenatal clinic must be attended by the mother at least once a month during the first 7 months, twice a month during the 8th month, and on a weekly basis in the 9th month. Why do we need these antenatal visits? The antenatal visits facilitate a proper planning and allow for adequate care to be provided during pregnancy for both the mother and the fetus. Recording the date of the last menstrual period is very important, and to calculate the expected date of the delivery so that we have an idea when she is going to deliver. The health status of the mother can be assessed, and if there are any medical illnesses that she might be suffering from, that should be detected in time. To a baseline record of information related to her weight, her BP, hemoglobin estimation, all this should be done. Besides this, any timely detection of complications at an early stage will help to manage an appropriate referral. Also, to confirm if the pregnancy is wanted or not, and if the pregnancy is an unwanted one, then she should be referred to the appropriate PHC or first referral unit that provides safe abortion services. So, when a lady comes for the antenatal services for the first time or for the first visit, what all should be done, what all should be included in that visit. So the first thing is that a detailed history should be taken from her regarding her pregnancy, how she came to know about the pregnancy. Then the next thing is if she is having any medical illnesses, any problems that she faced in her previous pregnancy, or the history should be taken in great detail, and then we should proceed towards the physical examination. So in physical examination, the first thing is to know the vitals, which includes the pulse rate, the respiratory rate, the temperature and the BP. And the BP should not be more than 140 by 90, because that will millimeters of mercury, because that will indicate any pregnancy induced hypertension or chronic hypertension. And if there are signs of pregnancy induced hypertension, then we need to be very careful, and we have to protect we have to prevent any cases of eclampsia. So that has to be kept in mind, that we have to look for signs of preeclampsia and prevent eclampsia. Then also we must pay attention to other like in the general examination to other signs, like if she's having any pallor, that will suggest that she is having anemia, which can be very bad for her, detrimental for her health as well as the baby's health, and her recovery will be very poor after pregnancy. So we have to look for pallor, icterus, or if there are any signs of edema, if there is any swelling, uh, then we have to detect that. And the importance of edema here is that usually pregnancy is a hypovolemic state, and ladies tend to have pedal edema, but it should not be there after resting. If she has had an adequate rest or an overnight sleep, then in the morning she should not be having any edema, because if she is still having edema, then it might indicate some other reason. There can, if she's having some generalized edema, or if she's having some edema on her face, then it will indicate maybe a problem related to the kidney. So that has to be kept in mind, because we have to prevent the complications. Then weight gain. So ladies gain around 9 to 11 kgs of weight during their entire period of pregnancy, and if there is a poor weight gain, then it may be indicative of intrauterine growth retardation. If there is excessive weight gain, then it can be because of preeclampsia or twin pregnancies or diabetes. Then moving on to the breast examination. So breast examination is also very important. We have to look for if there is any lump in the breast, or if she is having any pain or tenderness in the breast. So superficially the breast should look normal, and then on palpation it should be no, there should not be any lumps or any tenderness. The nipple, we should examine the areola and the nipple also, and look for an inverted nipple or an everted nipple, or if there is any discharge from the nipple. So we have to pay attention to that. Then abdominal examination. So in the first visit, there may be no finding on abdominal examination, but if it is early, if it is like as early as in the first trimester, so at 12 weeks the uterine fundus is just palpable per abdomen, and that is the first time that you can palpate it. Then at 20 weeks the fundus is flat at the lower border of the umbilicus, and at 36 weeks the fundus is at the level of the xiphisternum. Then on abdominal examination you can hear the fetal heart sounds after the 6th month, and that is around 120 to 140 beats per minute, that is normal. Fetal movements are also felt after 18 to 22 weeks of pregnancy, and fetal parts can also be felt after 22 weeks, and they can be very distinctly felt, like you can differentiate between the head and the back and the limbs after 28 weeks of pregnancy. Then also in antenatal visits, you have to pay attention whether there are any multiple pregnancies. So if the uterus is larger than the estimated gestational age, or multiple fetal parts are palpable, then we have to take care that it might be a multiple pregnancy, and we should be very alert and take care of the lady accordingly. Then fetal lie and presentation. So it is only relevant after 32 weeks of pregnancy. So after 32 weeks we have to take care that it is not a transverse lie, because in that case a normal vaginal delivery is very difficult, and so we have to pay heed to that. Then inspection for any of abdominal scars or any other relevant abdominal findings. So we should know why there is a scar, what is the history, what was the problem. Maybe she have had a cesarean section previously, and that has left a scar, and there can be additions or thinning of the uterus at that site, at that point. So we should be very careful, and because this will help us to decide whether the patient should be going for a normal vaginal delivery, or she should continue with a cesarean section. So, assessment of the gestational age can be done by investigations like an ultrasound, and which is important in the first visit to ensure fetal well-being. And lab investigations on the first visit will include a complete urine analysis, along with stool examination with a complete blood count including a hemoglobin estimation, then blood grouping and RH typing, with chest X-ray examination and pap test, or and a gonorrhea culture test if possible. When we then on subsequent visits, when the lady comes for subsequent visits, then physical examination is important, where we see that she is having a regular weight gain. We keep checking her vitals to rule out that she is not having any fever, or her BP is not abnormally increased. Then besides that, hemoglobin estimation is essential to see that she's not anemic and she is taking her iron and folic acid supplementations. Then urine examination is done to rule out any infection that may be festering. Then for immunization against, we should advise her to get immunization against tetanus, and instructions regarding nutrition, family planning, self-care, delivery and parenthood. All this should be given. ये क्या है? मैं ऑलमोस्ट खत्म होने वाला था, मतलब